Hello and welcome to our KFF Health News recap of the confirmation hearing at the Senate Finance Committee for Dr. Mehmet Oz to be administrator of the Centers for Medicare and Medicaid Services. For you What the Health podcast listeners, we'll also post the audio of this conversation in our feed as a bonus episode. We're taping this at 3 p.m. on Friday, March 14th, and as usual, news happens fast, so things might have changed by the time you see or hear this. I am joined today by my KFF Health News colleagues, Rachana Pradhan.
Hi, Julie.
And Stephanie Armour.
Hi, great to be here.
So Dr. Oz's hearing was the last for 4 nominees to head the major operating agencies of the Department of Health and Human Services. Those are CMS, the Centers for Disease Control and Prevention, CDC, the National Institutes of Health, NIH, and the Food and Drug Administration, or FDA. Before we dig into the details of the Oz hearing, which I think it's safe to say went pretty well for him, let's do a quick update of the nominees for those other 3 agencies. On Thursday, the Senate Health, Education, Labor, and Pensions Committee approved and sent to the Senate floor the nominations of Stanford health policy researcher Jay Bhattacharya to head the NIH and Johns Hopkins surgeon and policy analyst Marty Makary to head the FDA. The votes were far from unanimous. Both nominees are at least somewhat controversial, particularly Bhattacharya, who was a leading critic of the way most of the rest of the public health universe handled the COVID pandemic. But still, it seems safe to predict that both of these nominees will be confirmed by the full Senate, right?
Yes, I think so.
Nothing that I saw, it seemed like very much, even though, there were some pushback from Democrats, it definitely seemed like I would assume both of them are going to go forward.
So we haven't seen any, there hasn't been any evidence, even with some of the controversies around them, that there's anything that will keep them from taking up their positions, I guess, when the Senate comes back from its recess the week after next.
Well, if anything, the criticism that they had in terms of the Barrington Declaration and the COVID response, if anything, Republicans seem to be very much like, yeah, we agree with you.
Remind us what the Barrington Declaration was.
It was basically the idea of instead of the kind of quote lockdowns that we were doing, it was to protect the vulnerable, like the elderly and immunocompromised, and kind of just let the virus run through the rest of the population.
And that was led by Jay Bhattacharya, right? Did he write it, or
yes.
He was just one of the...
He was one of 3 authors, and they got more signatories eventually, but it was heavily criticized by leaders of the NIH at the, when it was being drafted as something that they and other public health, epidemiologists and scientists said that, was not. They had a lot of ethical questions and also said it wasn't really feasible, but Jay Bhattacharya, I would say a big part of his rise was associated with that declaration.
With being a COVID contrarian, I guess that would be the phrase to call him. So it seems pretty safe to say that those 2 nominations are in good shape. The same can't be said, however, for President Trump's original nominee to head the CDC, former Florida Republican Congressman Dave Weldon. Weldon's nomination was pulled just hours before his scheduled nomination hearing Thursday at the Help Committee because, as committee chairman Bill Cassidy explained succinctly to reporters afterwards, he didn't have the votes to be confirmed. What are we hearing about why he didn't have the votes and why it took them literally until the last minute to realize that?
I believe it was, from what I recall, it was largely that he had been very skeptical about certain vaccines and health risks of those vaccines. And it was seen that that was going to be a barrier to confirmation.
I think also the worsening measles outbreak in Texas and now New Mexico probably did not help things. But the other thing too, I think that even we've talked about here in our newsroom, which is certainly Dave Weldon was not the only anti-vaxxer or vaccine skeptic. Our new HHS secretary, Robert F. Kennedy Jr., espouses many of the same views, but he, of course, got through. And why is that? But I think RFK Jr. has a huge following, and I think what I would think is perhaps a greater backing from the president than Dave Weldon did, and so that also it could have played a role in why he was pulled. So we'll have to see who comes next and whether they espouse similar views or not.
Is it also that CDC is so intimately involved in vaccine issues? It oversees the vaccine, both the vaccine program that gives out vaccines and the vaccine advisory committee, and that RFK Jr. has already done things like delayed meetings of vaccine advisory groups. Maybe there's a little buyer's remorse on the part of some of the Republicans who voted for RFK Jr.
Right, of course, the CDC's guidance on vaccinations and vaccine schedules for children and adults, of course, it is the agency that is responsible for promulgating those guidelines. Then that serves as the basis for doctors' offices, schools, universities, for vaccine, to the extent that we have vaccine requirements in this country. It's incredibly important what the CDC says.
And I will say, during the hearings with Marty McCreary, he was very adamant that the advisory committee on vaccines would continue to meet. I know that there was the one that was canceled looking at the flu vaccine, and I thought that was notable that he said that would continue.
Yeah, although that's one of those things that's sort of handled between the FDA and the CDC. But
Yeah.
I think it's fair to say the CDC has more direct authority over vaccines. I mean, the FDA licenses them, but the CDC then decides who's going to get them. It's kind of a joint effort. Well,
Mhm.
let us move on to Dr. Oz. For those who don't know, the Centers for Medicare and Medicaid Services oversees not just Medicare and Medicaid, the two largest health insurance programs in the nation, but also the Children's Health Insurance Program and the marketplace portions of the Affordable Care Act. So it is a very, very large agency that has the most money of any sort of sub-agency in HHS. It may be the most money of any sub-agency in the entire government. I will say my initial impression from watching the hearing was that Dr. Oz did a pretty good job. I mean, certainly compared to RFK Jr., who clearly had not done his homework for either of his confirmation hearings. He, of course, appeared both before the Senate Help Committee and the Senate Finance Committee because they share jurisdiction over health care. But the Senate Finance Committee didn't vote. Or excuse me, the Senate Help Committee didn't vote, only the Senate Finance Committee votes. And again, on CMS, only the Senate Finance Committee has jurisdiction, so they have the hearing and they will vote. We're gonna play a little bit of what Dr. Oz had to say in his opening statement, which I thought was sort of well done for hitting all the sort of points that you want to hit without being partisan and without irritating either side. So let's go ahead and play that clip.
I would argue, I know you all agree, America is too great a nation for small dreams. So here's some big ideas. I'm going to limit it to three so I can get to the questions that I want to pursue if I'm confirmed by the Senate. First, we should empower beneficiaries with better tools and more transparency so the American people can better navigate their health as well as dealing with the complex healthcare system we have created for them. As an example, I think President Trump's executive order on transparency shifts power to the American people. Let's make America great again and make it healthy again by informing people so they can be in charge of their well-being. Second, we should incentivize doctors and all healthcare providers to optimize care, but we have to do that with real-time information while they're taking care of patients and within their workflow. Artificial intelligence, I believe, can help. It can liberate doctors and nurses from all the paperwork, which, by the way, is as much time they spend on paperwork as taking care of patients. They should focus on patients as better use of their time. And third, let's be aggressive in modernizing our tools to reduce fraud, waste, and abuse. This will stop unscrupulous people from stealing from vulnerable Americans and extend the life of the Medicare Trust Fund.
Buzzwords, yes, but also exactly what you're supposed to say when you're the nominee to run this agency, right?
I thought he did really well. I thought it was clear he'd done a lot of preparation work. Even when he would comment on meetings he had with various lawmakers, he would say, I went and researched this afterwards. His experience in TV certainly came across in terms of his confidence in the room. And he was, I thought, able to answer questions well and also deflect them pretty well when he wanted to. But I would say I agree with you overall. I thought he came off quite well.
Yeah, I would agree with that. It's clear, a TV guy is a TV guy. So he was quite, and he was connecting with, senators on even a more detailed level, which you could tell, bringing in anecdotes from meetings and just talking to them. So I think of all the nomination hearings, that have occurred with this administration's health appointees, I would say this one was probably the smoothest, I think.
Yeah, I think smooth is a really good word. Of course, for those who are not aware, it's hard to imagine that people aren't. Dr. Oz first, I mean, he's a cardiothoracic surgeon. He came to fame on Oprah Winfrey's show, and then he had his own show for more than a decade, where things got controversial, and we'll get to that, but a little bit later. So one of the few, I think, surprising things that came out of this hearing, because it mostly went, I think, according to script, was that he was for someone who has been very let me rephrase this. For someone who's been very positive about the future of the Medicare Advantage program, including owning stock in some of the companies that operate Medicare Advantage, which he has said he will sell if he is confirmed, Dr. Oz had some surprisingly critical things to say about some of the ways the Medicare Advantage program operates, to the point where I think there may be some Medicare Advantage executives who are not going to have a very happy weekend this weekend. Let's hear first what he had to say to Senator Wyden about some of the marketing abuses of Medicare Advantage.
What do you think the biggest abuses are right now in the private insurance sector?
Medicare Advantage sales.
Such as? I mean, give me an example.
There's brokers that get involved in churning policies. So they get you to switch from policy to policy. We should potentially consider whether you need to re-elect Medicare Advantage every year and potentially offer multi-year programs for seniors, because that would save some of the money that the brokers are taking out of the middle. Some brokers do a great job, some don't. We probably have too many. I think there are ways for us to ensure that marketing process works better for the folks involved. But it's also what the Medicare Advantage plans also do with the monies that they use to incentivize the American people, the 33 million people on Medicare Advantage, to come into their programs. And we should examine whether some of that money should be reimbursed to the American people to ensure that Medicare Advantage does not cost more than fee-for-service Medicare.
Wow, there was a lot there. One of the big ones, of course, was what he threw in at the end, and he'd said it earlier in the hearing, which is that Medicare Advantage should not cost more than Medicare fee-for-service, which was the original idea of Medicare Advantage. What happened was the managed care companies came to Congress and said, hey, we can provide all of the benefits that regular Medicare provides, but because we're managing care, we can do it cheaper, which is how the program started. And then eventually, over the years, they gave them more and more money. Congress gave them more and more money. And now, of course, Medicare Advantage per beneficiary costs more than Medicare fee-for-service per beneficiary because, and if you read KFF Health News, little nod to some of my colleagues here, there are an awful lot of abuses that go on beyond even what Dr. Oz was talking about with the brokers. Were either of you as surprised as I was to see him actually say things that could dramatically change how Medicare Advantage operates?
Now, normally I would not expect a Republican nominee for CMS to say the things that he did. I believe, Julie, you will know this, but I think, if I recall correctly, that the Affordable Care Act actually had a provision that was supposed to equalize reimbursement rate or costs between fee-for-service Medicare and Medicare Advantage. So that was, of course, a Democratic law. Medicare Advantage has a lot.
That was because the Medicare law, the Medicare drug law that the Republicans passed, had dramatically increased spending for Medicare Advantage because they wanted to give them extra money so they could get more people into Medicare Advantage, which it did.
Right. So Medicare Advantage has a lot of bipartisan support on Capitol Hill, to be clear, but I would not have expected a CMS administrator nominee in a Republican administration to suggest that.
Stephanie?
I agree. I was sort of surprised by that, especially in light of there's been some push among Republicans to make Medicare Advantage the default sort of sign up for people. And to hear that he wants to equate those costs and make them be similar, it's fascinating. And I'd be really interested to see what his ideas are for doing that.
Yeah, so would I. Well, on another Medicare Advantage related issue, one of the criticisms of Medicare Advantage is that one of the ways that these companies make extra money is by denying care to patients through something called prior authorization, which is so basically telling the doctor that he's got to get permission. Doctor says, I want to prescribe this drug, and then has to go through this entire rigmarole with the insurance company to get permission before the insurance company will pay for it. Dr. Oz is a doctor, and doctors tend to hate prior authorization, but still there was an exchange with Senate Help Committee Chairman Bill Cassidy, who's also a member of the Finance Committee, who's also a doctor, about prior authorization.
This issue of pre-authorization is a pox on the system. We spend 12% of the healthcare budget on administrative costs. Pre-authorization is misused in some settings. There needs to be a mechanism to confirm that procedures are worthwhile, but I'll offer some ideas on how this might work. And if confirmed, I'd love to push some of these ideas and share them with other members of the committee.
So prior authorization has been kind of bipartisan as something that, there may be an effort to scale back. Is this a suggestion that we could actually see some action on this?
I think he's touching on sort of an issue that has really galvanized the public in some startling ways. But I think that I do think there's potential to see some action here, based both on his comments, but also kind of where the public sentiment is these days on prior authorization and how cumbersome it's become, both for doctors and for consumers.
It is the kind of thing that, that populist President Trump would latch onto, like high drug prices and surprise bills. It seems like something that would be ripe for bipartisan addressing.
Yeah. Both sides could potentially claim a win there. And you've definitely seen the rhetoric and discussion about prior authorization and the toll it's taking. You've really seen that ratcheting up, I think, even in just the past year or two.
Oh, yeah. I mean, it's funny because I covered the Patients' Bill of Rights fight back in the late 1990s and early 2000s. And that was a huge rallying cry then. It was, I won't say largely taken care of, obviously not, because we're still complaining about it, but it was at least tamped down by the Affordable Care Act. That it insurers stopped doing it quite as dramatically for a while, but now it seems as prices rise, they want to, this is one lever that insurers can use to hold down costs. And when they use it too much, as it seems they are right now, it angers both patients and doctors, and eventually lawmakers. Rasha, did you want to add something?
No, you guys covered it. I think prior authorization is and like you say, Bill Cassidy is a physician, so I think he would probably be more inclined to not like prior authorization because of his own background.
Yes, and his own practice.
Yeah.
Well, the Democrats at the committee hammered on the Medicaid cuts that are being considered or will be considered soon, at least over in the House. We don't know what's going to happen in the Senate, but there were an awful lot of questions for the prospective head of CMS about whether or not he would support such cuts. They also talked about Medicaid work requirements, which are one of the ways that Republicans clearly almost all support reducing Medicaid spending. Here is an exchange with Senator Warnock.
My home state, Dr. Oz, the state of Georgia, is not only one of just 10 states in the country that still has not expanded Medicaid. It also has the dubious distinction of being the only state in the country where the limited number of families who do qualify for Medicaid are required to regularly complete bureaucratic paperwork to prove that they're still working the minimum number of hours to get health care. State officials call it Georgia Pathways to Coverage. I call it Georgia Pathways to Nowhere. The program is allowed under the state's Medicaid waiver, which is up for renewal this year. And if confirmed as head of CMS, you would be responsible for approving or denying the state's application to renew this onerous paperwork requirement. Dr. Oz, I'm not going to ask you to prejudge the state's renewal application. That wouldn't be fair. You need to see it. But since you would oversee Medicaid if confirmed, yes or no, do you believe that families should have to complete government paperwork every single month to prove that they're working just to get health care when they're sick?
Senator, I appreciate your question. I enjoyed visiting with you. My wife, went to Union Theological for a while, different time than you. I brought her as a support staff.
Good.
To make sure.
That gives me comfort. Yes or no?
The answer to me is I am in favor of work requirements, and I don't believe we should allow.
Do you think a family should have to fill out paperwork every month just to get health care?
I don't think you need to use paperwork to prove a work requirement, and I don't think that should be used as an obstacle, a disingenuous effort to block people from getting on Medicaid. However, I believe we would both probably agree that there's value in work, and it doesn't have to be going to a job. It could be getting an education. It should be showing that you want to contribute to society. Frankly, you could volunteer at Ebenezer Baptist Church, where I did a show with you once. That would, for me, fulfill the requirement.
You'll never get any pushback from me about the value of a work ethic and the purpose that work provides, which is why I think people ought to have health care so they can get back to work.
Yeah, he's really good on TV. This was such a good example of sort of ducking the big question there, because what we know about work requirements is that the reason that people end up losing their Medicaid because of them is not because they're not working. It's because, as Senator Warnock said, they have to fill out all this onerous paperwork every month. It's hard for them to prove that they are working. Most people on Medicaid already work. I guess we didn't really hear anything there that takes away from sort of the Republican effort at work requirements, right?
I do think it was telling how explicit he was in saying that we are not doing this to make people lose health coverage, even though the result often is that they do, right? Because of the reasons you just said, Julie. But I think that that's not the kind of tenor that we've even heard in the past when Republicans have talked about work requirements. A lot of the time, even currently in Congress, the language is more like they're not working when we know that they are, right? At least the evidence shows that they are, surveying shows that they are. So I thought it was quite telling that he was very explicit that the aim is not to kick people out. Yeah, but again, he openly said that he supports work requirements, which I think you would have to be if you are going to serve in this administration.
Yeah, I think if he didn't, he wasn't. That would be a problem for Republicans to vote for.
Right.
Stephanie?
Well, I think Democrats were slightly rankled by the fact that he started the hearing by saying we need to cherish Medicaid, but yet he wouldn't agree to say that he wouldn't back cuts in the program, and also that he supports work requirements. I think those are two things that Democrats are very opposed to. So there was definitely some eyebrows raised, but though it was expected points too.
Well, it wasn't completely a walk in the park for Dr. Oz. He obviously has a bit of a colored history. He ran unsuccessfully for Senate in 2022. He was haunted by some of his demons. A big one would be some of the diet supplements and other things that he frankly hawked on his TV show. And Senator Maggie Hassan of New Hampshire had some sharp questioning about that.
In 2012, you enthusiastically recommended several supplements for weight loss on your television show, including a substance called green coffee extract, which we now know was fraudulently marketed. For the record today, can you confirm that you no longer believe that green coffee extract is a miracle weight loss drug?
I never said that medication was a miracle weight loss drug, but I am.
Can you confirm that this was fraudulently marketed and green coffee extract is not a miracle weight loss drug? Yes or no?
Yes.
Okay, so let's go on to, you promoted a supplement called raspberry ketones, claiming that it is, quote, a #1 miracle in a bottle to burn your fat. That's your quote. Will you confirm for the record today that you no longer believe raspberry ketones to be a, quote, miracle in a bottle?
There are many things I said on the show. I take great pride in the research we did at the time to identify which of these worked and which ones didn't. Many of them are still bean researched, like the green coffee bean extract you just mentioned.
So how much were you paid to promote these supplements?
The television show was distributed by Sony Corporation.
How much were you paid to promote the supplements?
I was paid nothing to promote the supplements, but
But you promoted them on your show, and there was something called a Dr. Oz effect. You would mention them and the sales would go way up.
that was written about by the press. That was not something that I would talk about on the show.
I will just go on the record that you have been nominated to run the largest health programs, the set of largest health programs in the United States of America. And it seems to me you are still unwilling to take accountability for your promotion of unproven snake oil remedies to millions of your viewers. And that's really concerning.
Now, that criticism goes back more than a decade. He was actually brought before the Senate in 2014. There was a very testy hearing about some of the things that he had been promoting. More recently, though, we've learned that he may not have paid all of his Social Security and Medicare taxes, which ranking member Ron Wyden of Oregon pointed out early in the hearing.
Now, once again, Finance Committee investigators start the process by bringing the receipts. Dr. Oz is the second Trump nominee to come before the committee this year with a record of dodging Medicare and Social Security taxes. This tax loophole hurts Medicare and has benefited Dr. Oz by $440,000 in the last 3 years.
Obviously, some of these things have been known for a long time about Dr. Oz's background, some of them less so. Does either one of them seem to be at all threatening to his getting this job?
No, I don't think so. But I do think it's something to keep an eye out for, just given the sway that CMS, of course, has over Medicare, Medicaid, and ACA plans. And every year there are rules that are set about coverage requirements related to those plans. And so, supplements, I think, are an area of interest, both because of Secretary Kennedy's beliefs in them too, and of course Dr. Oz's too.
And I think overall, despite kind of being put on the spot over the supplements that he touted on the show, I thought his answers came off pretty good. He was saying, well, I wasn't directly paid for this, and the Oz effect was something others wrote about. I thought he handled it as well as he probably could.
He was pretty clearly pretty well prepped for this. I mean, he obviously knew that question was going to come from somebody. Any parting thoughts? I mean, I feel like, I think, Rachana, you said, of all the Trump nominees that we've seen, this one seems to have gone the smoothest in terms of a confirmation hearing. I'm seeing nods.
Yeah,
okay.
Definitely. Yeah.
Then we will leave it at that. I want to thank you all for joining me, my colleagues Rachana Pradhan and Stephanie Armour, and Hannah Norman for wrangling all of our tape. And we will see you soon. Thanks.